Hi, I'm Susan Previs, here to encourage you with NICU breastfeeding information. When you have a baby in the NICU, you may wonder if you can even breastfeed or how you will do it. Your NICU lactation consultants and the bedside nurses are here to help you. Breastfeeding in the NICU can be very different. Your baby may be very tiny and immature. Your baby may need respiratory support for many weeks. Mothers still need to pump every 2 to 3 hours to build and maintain their milk supply, and they need to pump even at night. Sometimes mothers are pumping for many weeks. But as early as 32 weeks, your infant may be ready to nuzzle at the breast. Every baby is different and will need lots of patience and persistence. This is a very tiny NICU baby. She was born at 27 weeks plus 3 days gestation. She is IUGR, intrauterine growth restricted. So she will most likely be on respiratory support and IV fluids for nutrition and hydration for many, many weeks. But note the orange tube. That is a feeding tube, and we can give your baby breast milk through the feeding tube. The first breast milk, colostrum, helps prepare the infant's stomach for feeding, and it's gentler on the stomach. Colostrum also helps to protect your baby from infection. And we can show moms and dads how to do oral care with colostrum or breast milk. Oral care takes the good bacteria, enzymes, and antibodies from mother's milk and supports the baby's growth and development. It also helps to protect your baby from infection. Late preterm infants, 34 weeks to 36 plus 6 weeks gestation. I call them the great imposters. They may look like normal term babies, but they can be very immature. They can be very large or they can be very tiny. They may be able to breathe on their own normally, or they may need respiratory support. They may need an IV for hydration and nutrition, or they may not. And sometimes they breastfeed great, and sometimes they just take longer to learn. Late preterm babies may need very different levels of care. We will support them in their respiratory needs, nutrition, maintaining warmth, and in a few days to a few weeks, they should be able to breastfeed. Full-term infants, remember, every baby is different. When your baby is born full-term, they may be in the NICU because they need respiratory support, or your baby may be able to breathe normally. If they need respiratory support, they may not be able to breastfeed or bottle feed right away. Sometimes they are in the NICU for observation and they breastfeed just fine. In that case, breastfeed as often as you can. Pumping is still important because you're separated from your baby. K-Care, or skin-to-skin holding, helps promote breastfeeding. You will wear a hospital gown and your baby has on a diaper only. And K-Care is great for breastfeeding. Early K-Care helps mother's milk to come in. K-Care can help to regulate your baby's breathing, heart rate, temperature, and even blood sugar. For mothers, feeling your baby on your chest and smelling your baby helps your milk to come in. The hormones of lactation get churning and they help to bring the milk down. K-Care. Even babies can smell their mother's milk and they try to scoot down to the breast. Your baby can feel your skin against his or her skin, and this helps the natural instincts and feeding reflexes to begin. Babies will often try to move towards mother's nipple and try to latch. Sometimes they do this with fathers too. Nipple shields can help improve your baby's latch. Nipple shields can increase milk transfer up to 45%. Nipple shields are soft silicone and they have holes in the nipple portion so the baby can have milk transfer. They can help a preemie position the nipple in their mouth to create the suction needed for milk removal. The shield also can help the baby when they're pausing to swallow and breathe without having to reposition the nipple in their mouth every time. The nipple shields can also be very helpful for mothers who have flat or inverted nipples. And nipple shield use is not forever. It's usually only temporary, a few days to a few weeks, until your baby can latch and suckle with long draws and swallows and have good milk removal. A football hold. In this picture, you see a baby latched on with a nipple shield. The football hold is the preferred hold in the NICU. It helps you to be able to see your baby, see his mouth and face. It helps you to keep your baby warm by keeping your baby nice and close. And the latch is very important in breastfeeding. Latch just means that the baby has mom's nipple in the mouth. The lips are flanged like a fish around the nipple. And the baby's tongue is down and extended around the nipple. Your baby may be on the nipple, but not sucking right away. Sometimes it can take up to 2 or 3 minutes for the baby to begin to suckle, and that's okay. We call it getting organized, and it's really normal baby behavior. In this picture, you can see mom is holding the baby in the football hold, and we support her hands and arm and the baby with pillows and folded blankets. If your baby's not comfortable, he won't latch. And if your mom is not comfortable, well, she's not going to want to breastfeed. If you have nipple pain, we will help you to relatch your baby. Breastfeeding shouldn't hurt. Cross cradle hold is a very good transitional hold. It's easy to move the baby from one breast to the other breast, and the hand moves from one side to the other breast. And you can see in this picture, mom is still skin to skin with her baby, which is really the best thing for brand new babies learning to breastfeed. Now, as babies grow and they're more mature and they gain skill with breastfeeding, mother and baby can be fully dressed. This normally happens when we get in closer to discharge. Tandem breastfeeding. Breastfeeding multiples. I know it seems very challenging to breastfeed 2 or even more babies. And we in the NICU, we are here to help. First, it's important to let each baby breastfeed separately. And until they get good at latching and staying latched and sucking, then eventually we will add the other baby and both babies will try at the same time. We will help you with positioning and stay with you until you feel confident. It's a good idea to tandem breastfeed frequently before your babies are discharged. That way you have the confidence to breastfeed them both together when you're home. Fathers, your partner needs you and your baby needs your support. We welcome your presence in the NICU. Breastfeeding isn't all about mothers and babies. Dads can help mom keep on track with pumping, washing pump parts, helping the baby position at the breast. You can watch and make sure that the baby is having a good latch. You can make sure that the baby is staying awake, and you can help the baby stay awake by lifting his arm and moving it a little bit. We appreciate Dad's insights. Dads have a big impact on baby's development from birth. When babies are born, they need to connect with both parents. Your NICU lactation consultants and nurses are here to help you meet your breastfeeding goals. Please don't hesitate to ask for assistance. It's important to remember that breastfeeding your NICU baby is possible. Give your baby and yourself patience. You are both learning something very new. The first few times to the breast may be like a meet and greet. Your baby latches, maybe has a few suckles, falls asleep at the breast. That's normal. It's actually a good breastfeeding for a premature baby. Both mother and baby have to figure out what to do. Fathers, your support can mean the difference between mom breastfeeding successfully for weeks to months or throwing in the towel and saying, I just can't do this. So dads, please be supportive of the moms. We want to help you, so ask for help whenever you need it. Thanks for watching, and we'll see you in the NICU.